Alrighty. Hey everyone. Thanks so much for joining us tonight for National Initial Event. I'm Carla Campoverde Pesantes, a second-year audiology student at the University of Buffalo, and I serve on the National NISLA IDEA work group. I'd love to introduce our moderators for tonight, Andy and Lila.
Thanks, Carla. My name's Andy Riuda. I'm a first-year speech-language pathology graduate student at California State University, Long Beach.
And I'm Lila. I'm a first-year speech communication disorder student at the University of Virginia.
We'll be keeping an eye on any questions you have throughout the night, so just drop them in the Q&A box and we'll get to them.
Alrighty, so National NISLA's Raw Conversations is our live event series where we dive into important topics around diversity, equity, and inclusion that helps us become better students in our CSE programs and stronger professionals down the road. Our topic for tonight's event is connecting across languages, multilingual experiences, and approaches in communication sciences. We've got an incredible group of panelists joining us from different backgrounds and language experiences, all bringing their expertise on what it's like to navigate our field as multilingual professionals. Even though we've prepared some questions for our panelists, this event is all about open discussion. So please ask questions using the Q&A feature on your Zoom bar. Seriously, don't be shy. Feel free to drop comments in the chat too, and that's where we'll share any helpful links. We're so lucky to have these panelists who've carved time out of their crazy work schedules to help us learn about multilingual perspectives in CSD. With that, let me introduce our awesome panel. I'll have each panelist introduce themselves and tell us a bit about their background, including the languages they speak.
You want us just to jump in?
Yep, go for it. Sorry about that.
That's all right. Hello, everyone. Welcome. I can't see you all, but my name is Mariam. That's how it's pronounced in Farsi, which was my first native language. I am also, as you can hear, proficient in English, and that's become my dominant language for quite a few years. I graduated with my master's degree in 1996, probably before most of the attendees in this room were born. And so started clinical practice with a pediatric population. I worked across different settings. Then I started teaching at a university in 2003, and it took me a while to actually make a commitment to go back for my PhD. I've been in Boston for, this is my 8th year as a full-time academic faculty. I do some, I'm sorry. I do some supervision as well. And I'll be talking about some of my experiences related to bi and multilingual kids tonight with you all.
Yeah, I think I don't know if they hold on to those. Should I just like wait till we're at the front?
Sorry.
Be like, hey, I think
Everyone, please mute their microphones, please. Thank you very much.
Hello, everybody. Thank you so much. Thank you for the invitation to participate, to the organizers, and thank you to all of you for your interest and for being here. My name is Alejandra Yulari. I'm an audiologist. I'm originally from Ecuador, born and raised in Ecuador. I came to school to the US many years ago. I've been in clinical practice for, I'm going to say nearly 25 years. And Spanish is my first language, obviously, and I think still my dominant language. And I do have a very thick accent, so good luck, good luck with that. Based in Chicago, and I've done a little bit of a lot of things. I've been in clinical practice in hospital settings, in private practice, in academic centers. When I moved to the US and in 2012 and started working in hospitals and after that in private practice, I had the opportunity to precept audiology students, and I cannot tell you how much I enjoyed doing that. I'm really passionate about young students trying to become professionals that will make a difference in our field. So I'm super excited to be in an event like this. Right now, in 2021, I was still in clinical practice, and I decided to open Audiology en Español, which is an educational platform that teaches medical Spanish for audiologists. And then in 2023, I thought, I'm really passionate about this topic, and it's really hard to do both. It's really hard to try to, get audiology en español up and running while running a private practice. So I decided to sell my practice and concentrate on, audiology en español and its mission and everything that we were hoping to accomplish. So I'm really enjoying my time right now, and we started doing medical Spanish courses for professionals, but now the biggest interest, commitment, and excitement about the topic is with bilingual students. So we are, holding conversations with lots of universities, trying to bring the curriculum to those programs. So yeah, thank you so much for having me.
My name is Carissa Terry. I am a fourth year student at the University of Memphis. I'm not quite in the field yet. I completed my undergrad at University of Northern Colorado, where I majored in audiology and speech language sciences, which is what it called then, but now it's called CSD, and minored in American Sign Language and special education, but I have been using sign language my entire life. And that is something that I use in clinical experiences with my patients to communicate with them. And I was born deaf as well. My introduction's a little short because I don't have all the fun experience that everybody else has.
Okay, my introduction will be short too. Hi everyone, my name is Emma. I'm a SLP student at Teachers College, Columbia University, and I was a member of National NSLA's IDA workshop last year. A little bit about my background, I was born and raised in China, so I speak Mandarin. 大家好. And as I live and study in the States now, English became my daily language at school and work. But back home, I still speak Mandarin to my friends and family members. And I'm excited to share some perspectives on multilingualism. Thank you.
All right, awesome. Thanks, everyone. Now we're going to jump in. So, for tonight, we're exploring the unique perspectives and experiences of multilingual professionals in our field. Language shapes how we connect with clients, navigate workplace dynamics, and contribute to more inclusive practices in CSD. We will spend the first hour hearing from the panel, and then the last 30 minutes in breakout rooms engaging in smaller groups. Alrighty, so for first up, we're diving into your personal language journeys and how language has shaped your social experiences. So start dropping your questions about this topic in the Q&A. We want to hear from you. So first, Dr. Ulari, how did you develop your multilingual skills? Was it through family, education, immersion, or other experiences?
Thank you so much. So I'm gonna tell you a little bit about how I learned English, because Spanish is actually my first language, and it was through so throughout my primary and secondary education, I went to some sort of bilingual school, and I had English classes, but I never went beyond, he does, she does, you do, we do. And it was actually when I came to university, and the first year I lived with an American family, that's when everything clicked. And that's when the extracurriculum classes I had taken in English while I was living in Ecuador, that's when everything made sense. So if I could draw from my experience, I would say that immersion is probably the most effective and the easiest way to learn a second language. as a clinician or as a student, I think a good way to immerse yourself, a good way to find an immersion opportunity while you are pursuing your studies is by volunteering either on missions to countries where they speak the language you're trying to learn, or by doing internships or externships or rotations in maybe community clinics where they are serving specifically communities that speak the language that you're trying to learn. Obviously, that aside from taking formal language classes, so you have the basis the basis to speak a new language, but then those activities such as being at a community clinic, doing a mission in a country that speaks the language you're trying to learn, it's going to give you that immersion opportunity where everything you've learned in the classroom actually clicks in.
That was great. Did anyone else like to chime in? Alrighty. So, Dr. Saleh Hamoum, how do you apply your language skills in your current career?
All right. So hello again, everybody. I jotted down a couple of notes. I've actually been asked to do bilingual assessments for Farsi English speaking children from preschool to about 5th grade. So they tend to be on the younger side. And this would, in most cases, this has been a referral for an initial assessment in 2 languages. So that's been one of the ways in which I've really I think, been a resource to districts in terms of doing the Farsi assessment. But I've always brought my really multilingual background into my teaching or instruction of classes as well. I mentioned I am bilingual in Farsi and English, but I actually started attending a bilingual program when I was young, so kindergarten through 3rd grade. And I went to a French and Farsi bilingual school. And then I started learning English prior to immigration to the US. And then as a professional, I had an interest in learning Spanish. So I took Spanish and have some conversational fluency in that language. And I worked with deaf and hard of hearing students. So I had taken some American Sign Language classes and then had to learn signed English because of the educational program that I was in. So I obviously have an interest in languages and have some basic skills in a few languages other than Farsi and English. So I bring examples when I teach classes about speech sound development and disorders, language and literacy development and disorders, and we try to talk about the phonological system across languages, phonological rules, grammatical rules. I use examples from a variety of languages, and I draw examples from the students in the class. We often have representation of at least 2 other languages in the graduate classes. So that's one way that I consistently actually use my knowledge of the few languages in teaching classes. And then I've also had some, other than teaching and doing the assessments, I've had some involvement in some extracurricular activities in our department. We have a group that is all about bi and multilingual kids. So every once in a while, or every year, they put on different events, extracurricular events for our undergraduate and graduate students. I've participated in that, and we also have an interdisciplinary educational event where we work with a couple different universities or departments that include a medical school, physical therapy, and social work. So I've also participated in those, and each time I've taken the case, like a profile of a bi or a multilingual child for us to discuss as professionals across those few disciplines. So those are a few examples of application.
Alrighty, thank you very much. Emma, how has language impacted your social interactions when there are grammar, syntax, or translation differences?
So there are 2 quick moments that came to my mind. The first is syntax to tone mixed up. So when I first learned English in a team meeting, I may say, this part change. In Mandarin, that's totally efficient. But in English, it sounds quite bossy. So I learned to add a softener like, could we tweak this part? And here's why. So the fix was about pragmatics. And the second one is there can be a translation trap. So when a parent shared a long update and I replied, 辛苦了, this is Mandarin, which means thank you for your hard work. But the literal English of this sentence is you must be tired. You have done so much. And it came off pitying. So now I translate the intent instead and say like I appreciate all you did. So the big picture is I treat language like a relationship skill. So notice the mismatch and then repair quickly and then keep moving.
Alrighty, thank you. And Carissa, how do you advocate for your multilingual clients, especially when they face language barriers?
Right. So I've actually had a few patients come into my externship site that don't have any notes on their chart or anything about using a sign language interpreter. But then they come in, they see me with a sign language interpreter behind me, and their face just kind of lights up because they have that connection. They're like, oh, you can facilitate communication with me. We don't have to speak. We can communicate through sign language. And then that kind of sparks a conversation of, hey, like, you might not always be able to see me. Would you like to be able to use an interpreter in the future? Because we do have video interpreting as well. And I think sometimes the first step is just seeing someone that has had those same experiences as you or speaks the same language as you. And then another part would be ensuring that my patients know about the resources like a video phone, caption phones, translation apps, whatever it may be that I have found to be beneficial for myself or other patients have shared with me that has been successful for them. And then the last thing would be sharing general things that I've learned. So one example was that AMC, which is a movie theater chain, it may not be where all of y'all are, but they do open caption showings every few weeks or certain days of the week. And a lot of patients don't know about that, and they don't go to the movies because they can't understand. And so for some of these patients, this is very helpful to be able to go and they don't have to worry about the little cup holder and the creaking sound of the captions or wearing heavy glasses on their faces. And then another one in St. Louis, we actually have a theater that does ASL performance shows every week when they have it open. And so we actually give tickets to some of our clients in our clinic to be able to go and kind of see that accessibility.
Alrighty, thank you. So now I'll be asking each question to someone specific to get us started. Then others can also jump in by raising their Zoom hands. So Lila, what questions are coming in from our audience?
Well, one question that I think we're going to start directed at Dr. Ulari, but hopefully everyone can chime in on, is what are some resources that you would use to become more familiar with the client's primary language, especially if you are someone who is monolingual and you didn't spend your education taking those language classes, you're past the undergraduate level, what can you do to jump in?
That's a very good question, and I'm going to apologize for self-plug here. But if we're talking about the Spanish-speaking community, we have developed some resources that we want to share with professionals, especially two resources specifically. One is on-demand classes that give you basic audiology vocabulary, how to introduce yourself to the patient, how to tell the patient what you're about to do, if you're going to do otoscopy or audiometry, and then give the patients instruction for the test. So we have basic modules like that. And then, of course, we have more modules that kind of build on that knowledge. But for those, you might need more, you might need higher linguistic skills in Spanish. The other resource that we have is a book that it's a language tool. So basically the book was actually created to aid either monolingual audiologists working with an interpreter, with a professional interpreter that might not be very familiar with audiology specific vocabulary, or maybe an audiologist who speaks very good Spanish, but maybe the patient doesn't seem to be understanding the specific instruction, so they can relate to these. I guess they can support themselves in this language tool. And basically, in the book, when you open it, you have this description of the test, the instructions for the patient in English on the left side and in Spanish on the right side. So you know what the patient is reading or what the interpreter is saying, and the interpreter or the patient have the Spanish version on that side. So we are trying to put together some of those resources to hope, with the intention that there are a lot of bilingual students that, they took Spanish in high school and they took Spanish maybe in college, maybe they did a semester abroad. So they have some Spanish, some level of Spanish, and, we need you all. So we want to make sure that these type of resources can motivate you to continue to advance your Spanish language skills and, expand them to a level that you can use them, in clinical practice. But we're counting on all of you because the field really needs you. And there is a lot of students out there who speak another language because they've already taken some kind of formal education. So I hope that answers. Thank you.
All right. Any other questions from the audience on this topic, Andy?
Yes, so I do have one for Dr. Salahuman. What are some ways to be an advocate for multilingual patients as an English-speaking SLP?
That's a great question. So I mentioned that I've done some assessments over the years for kids who've ranged in age from kindergarten to 5th grade. In most of those cases, the request for the assessment came fairly quickly in terms of quickly after a child was enrolled in formal education system or fairly quickly after immigration from Iran to the US. So in one case, for example, the student was a 5th grade student, but the family had immigrated to the US in less than 1 year when the district found me. I think one of the biggest issues that we have when we try to assess 2 or more languages for kids who are bi and multilingual is that the assessment's postponed for such a long period of time that what the child experiences is language loss in the language that was their first language or dominant language as they're shifting toward more proficient use of English. So if you do the bilingual assessment with prolonged delay since time of learning of English or since time of immigration, you're gonna have a more complicated time or difficult time differentiating between language difference, language learning versus language disorder. Although there are ways that we can talk about later to help you out with that. So I'd say one advocacy is really to be the voice in your setting, in your work setting, to say we need to do a bilingual assessment immediately, right? As soon as a child is enrolled in the program or as soon as the child immigrates to the US. I think resources, so lack of resources is an issue. So again, advocacy is about really collaborating with your coworkers in finding creative ways to be able to compensate for lack of resources, like an actual person who speaks Farsi or an actual person who speaks Mandarin who can do the assessment. So those are a couple of different examples.
All right, thank you, thank you very much. Would anyone else like to chime in before I shift gears a little? All right, perfect. So next up is career development and navigating workplace dynamics as multilingual professionals. Keep those Q&A submissions coming for this topic. I'll ask each question to someone specific to get us started, then others can jump in by raising their Zoom hands. So, Dr. Hulari, what are some common misconceptions about being a multilingual service provider that you've encountered?
So I'm gonna share one of my own experiences. And when I moved to the US in 2012, I came to work in a hospital in Chicago. And in Chicago, we have a big Latino community. And I was seeing that in my caseload, I mean, intentionally, a lot of the Spanish speaking patients, or Latino patients, I should say, were, on my schedule. And I can tell you there were days that I didn't speak English. I went to work in the US, never said a word of English because the patients I was caring for were Spanish speakers. The lady at the reception was a Spanish speaker. So pretty much my whole day, all my interactions during my work day didn't require me to speak English some days. And one thing that I learned was that I might have been assuming that obviously I had just moved to the US, right? And I was under the assumption if I saw a Latino name, I will come out to the waiting room and in Spanish. And some people gave me this look as in what a relief you speak my language. And I saw their faces shining. And some people looked at me like, what do you think? I don't speak English. And I learned it took me a little bit because at the beginning I didn't understand what was happening. But then I understood that I cannot make that assumption. And I also, the other way around, we cannot walk around assuming that everybody, depending on their names or last names, they speak specific languages. I think we live in very multicultural cities and so on, and we just cannot make that assumption. But I thought I wanted to share that because it might have not been a misconception that somebody had about me, but it was maybe a misconception I had about the local population that I was starting to work with.
Would anyone else like to chime in for that question?
Sure. Actually, go ahead. Go ahead.
I'd also like to add a misconception is bilingual doesn't always mean competent in every dialect, because Chinese has lots of dialects in different parts of region. And for example, in Chinese, we have Taishanese, Shanghainese, and Cantonese, and traditional Mandarin, and Taiwanese. And to be honest, Cantonese and Taishanese are completely a foreign language to me. So they are all called Chinese. So when working with those clients, I also need to have a interpreter or someone who can speak those languages. Okay, Dr. Hong, sorry, go ahead.
Yeah, thank you. That's exactly what I was going to bring up, except I was going to give an example of Farsi and also just talk about my awareness of the variety of dialects in Spanish as well. I see a couple of really wonderful resources from the ASHA website in the chat. So I really highly encourage everybody to look into those, but to consider them sort of like basic information and to really be mindful of the fact that you'll need to go beyond these kinds of published resources and getting a foundational sense of certain, if I can call them sort of stereotypical cultural, like reported information or even the linguistic information. I was once called in to do an assessment for an Afghan family's son. So because I know that there's multiple languages, including Farsi, which is a different dialectal variation of Farsi than in my native country, which is Iran, I confirmed, right? I asked the school district if the family spoke Farsi and not other Afghani languages. So they reassured me that they had asked mom that question. And then I met mom and I was further reassured that yes, we speak a Farsi that's mutually comprehensible. And so we scheduled the assessment with the child. But on the day the child showed up, they showed up with an older sibling, a sister, who also spoke Farsi, but with the Afghani dialectal variation. So it became clear to me through further questioning and in-depth interviewing that actually the boy that I was supposed to assess was mostly exposed to the other dialectal variation of Farsi that was not going to be the one that I was going to be using for the assessment. So I had to document that and talk openly to the educational team about it. Language, so expressive verbal language, was not, it turned out that it wasn't the biggest indicator of a disorder for this particular child. So we had all kinds of other observable information that there truly was a learning and a language disability or disorder based on other kinds of assessments or information that we got. But dialect is really important, and so is cultural variation. A person who's a Farsi speaker, or the community of people who are Farsi speakers, the community of people who are from Iran are quite heterogeneous.
Thank you. All right, moving on. So, Dr. Saleh Hammoum, how did you find your current role? Was your multilingual background a factor?
So actually, no. I started looking into positions the last year of my PhD program in 2017, and I came across an announcement at Emerson College. But my area of expertise in terms of clinical practice, and then at the time, the little research that I was doing was all about deafness. And the CSD department at Emerson College was looking for someone with expertise in deafness. So I was hired to develop online courses, which this being pre-COVID time was sort of ahead of its time then, not anymore. And to also develop and teach some of the courses related to hearing across the lifespan for the residential program. However, I mentioned earlier tonight that since coming into the department, the department really values diversity, cultural and linguistic diversity. And so we have a variety of extracurricular activities that I've been involved in. And in every graduate class that I teach, so speech sound disorders and language and literacy disorders, I often present the case of a bilingual child. So we talk about guidelines for assessing kids and then some unique considerations for intervention.
All right, thank you. Would anyone else like to add anything? All right. So now moving on to Dr. Ilari, how did you position your skill set when applying for your current role?
So my current role it's totally based on my bilingual skills because that's how audiology in Espanol started. But I have to say that before I moved to the US, I went to school many years ago here for undergrad, and then back then we didn't have the AUD, and I did a master's in audiology in Australia. And because of that, I ended up working some years in England. And then I went back to Ecuador I'm from Ecuador, so I went there to practice. My intention was to always go back home and work there. And so I lived there for like 6-7 years. And while I was there, the AUD came up and there was a transition format for practicing professionals that already had a master's degree. So I took advantage of that and did the AUD over distance. So I had to do 2 extra years to complete the curriculum. Anyhow, I worked in Ecuador for all these years, and the moment I decided that, multiple reasons happening in the country and changes in the political situation and so on, I decided that that was the time where, I was gonna move somewhere, kind of thinking about what was coming ahead. And I can tell you that being bilingual was what opened my doors to finding this job in the US, who at that point sponsored my visa and so on. I used to come to, obviously, there were a lot of things that were already in place. I already had an AUD. I was coming to every year to AAA to the meeting because I didn't have colleagues in Ecuador. I was one of 2 audiologists, and everybody else that practiced audiology in Ecuador had some degree of bachelor degree in speech and language pathology and audiology. So I didn't have another colleague that had, a doctorate level, and the only one that I had was somebody I could pick up the phone and say, I have a complex case. So I came to the AAA meetings with the idea of, number one, learning everything I can. Number two, making sure that what I'm doing at home is right because my patients don't have the luxury of a second opinion. And anyway, when I ran into one of my professors from the AUD, we had the conversation about how he was trying to hire somebody that knew about cochlear implants and was bilingual because of the population they served. And I was like, could that be me? Could I apply? And, to make a long story short, I had the interview the next day while at the meeting. And in the next 6 months, did all the paperwork to get a license to practice in the US and kind of plan my move here. So I would say that being bilingual was, the one of the main reasons why I was able to leverage my language skills to get this job. So I think I went way too long for the for the question.
No, thank you for your answer. Would anyone else like to answer as well? Yeah, Carissa.
So going into my externship applying process, I decided that I was going to be transparent about the use of American Sign Language and also a service dog and the need for accommodations in the clinic. And that guided a lot of my interviews going through the process. How does this work in the clinic? How do you set it up? How does the service dog work? Does the service dog get in the way? Do the interpreters get in the way? All of those questions came up in that process. And I think the important thing to recognize as a multilingual clinician is that you have the ability to connect with your patients in a way that other clinicians may not be able to. You're able to connect with them because you may understand more of their cultural background. You may understand more of where they come from. And that is a huge, huge, huge advantage to have in our field, to be able to connect with our patients and really be able to understand them and be on the same wavelength as them.
Would it be possible to add one thing, Carla? Just highlighting what Carissa said, I could not agree more. If you are, there are multiple levels of bilingualism, but if you are proficient in the language, that you can use the language effectively and safely in a clinical setting, the system needs you. I mean, we are an asset to the system because it means that number one, you don't have to go through an interpreter. And so you are truly providing is the best way to provide patient-centered care because you're providing you have a direct connection with the patient. And that goes a long way because when there is language concordant care, patients are more likely to ask questions, patients are more likely to, as a result, understand better their conditions, as a result, adhere more to recommendations, and of course, that all leads to better healthcare outcomes. And working with professional interpreters for the healthcare system is it adds an extra cost. So if you're proficient and you can demonstrate proficiency, the healthcare system benefits greatly from professionals, that have that type of skill. Thank you, Carissa. That was a great point. Thank you for bringing that up.
Can
Thank
I
you.
also chime in? I know we're limited in time, so you're welcome to. I just want to give a quick example of, I did work with a district who had a difficult time getting hold of the family or getting a response from them to initiate the assessment. Once they reached out to me and gave me the family's contact information, I'll never forget. It was a Saturday morning and I decided I'm just going to reach out to this family and see if they'll respond to me by Monday. 30 minutes later, I had a response and we had a scheduled interview a couple hours later on a Saturday. So that connection that Carissa and Alejandra have just talked about can actually be a game changer in, again, not just connecting, but then getting the family to open up, ask questions, give you information that's critical. And the second example is that we invited a deaf physician who uses ASL, works in Texas, as a speaker last year in our program. And he presented the case example of a woman who had been deaf, but initially when she came into the hospital, the emergency medical staff and the physicians had not used an ASL interpreter to communicate with her. And there were a series of reasons, language barrier being the biggest one, why she was misdiagnosed and about to undergo a series of assessments that would have been inappropriate for her. And thankfully, someone called in our physician, who was then able to get clear communication about what had happened. Huge misunderstanding. So healthcare outcomes that don't always have to be serious, but can be quite serious because of the language barrier. So yeah, absolutely. Diversity in cultural background, diversity in language, and language proficiency can be such an asset to any setting.
Thank you for all your great answers. For Carissa, what do you do when an employer setting or environment hasn't been supportive of multilingual practices?
And can I clarify, in terms of a clinician or in terms of the patient perspective?
Sorry. So I can repeat that again. What do you do when an employer or a setting or an environment hasn't been supportive of, I'm assuming your the clinician's multilingual practices?
Okay. For me as a clinician, I kind of just confront it head on. I will let them know that, hey, like I didn't appreciate that, or this was not the right thing to say, or this was not the right way to communicate with that patient, and kind of educate them, because more times than not, they don't realize that they're doing more harm than actually providing the accommodations. And then in terms of the patient perspective, so if a patient shows that their workplace has not been supportive of their accommodations or that kind of thing, depending on how well I know the patient, some patients want solutions and some patients just want to be listened to. And so if I know that they will want a solution, I'll kind of step in and be like, hey, have you thought about this? Have you had a conversation? Kind of start with the baby step first before talking about the extremes, because we don't need to jump right into the extremes. It's always better to try and address it face to face rather than to have to pull in a legal party or whatever it may be. And for those patients that just want to be listened to, I should make sure I document it. that they shared that they have been feeling frustrated or they've been struggling in their workplace, so that if that struggle or frustration continues to happen, we can try and kind of help that patient or encourage that patient to act out and have a conversation, whether that might be us writing them a letter explaining their hearing loss accommodations, whatever it may be. I hope that answers.
Thank you very much. Would anyone else like to answer that question as well? Okay. And then, Emma, how do you find balance between applying your cultural knowledge to cultures beyond your own while also advocating for yourself to step back when you don't have that specific knowledge?
So I think my Chinese background trains my ears for things like indirect refusals and how decisions often involve multiple generations, like grandparents. So I can notice when a maybe later really means no, not now, or when a grandparent quietly holds the final say. So with a family from a culture I don't share, I will take the lead on what I'm qualified or competent to do, like maybe language history, dynamic assessment, and plain language summaries. But if I feel like no, I have no knowledge about that, I will bring a colleague or some other professionals who are competent in that area. So all in all, just use what I know to open that door, but know when to step back, and bring in the right teammate to protect accuracy and trust.
Alrighty, thank you very much. Andy, what questions are our audience members asking right now?
Right now, I'll have one for Dr. Ulari. So, have you faced any challenges maintaining cultural and linguistic inclusivity during this political climate?
That's a tough question. I'm really struggling right now. So, yeah, it's a tough time. I think my situation right now is a little bit shield because I'm not directly in clinical practice. I'm interacting mostly with the students or professionals who are, interacting with patients. I have found that a lot of the initiatives that we were talking or were in the approval process, before the new administration came in, they have all gone through. So at the beginning, I was very fearful that we might all these efforts might not see the light of day, but they have all gone through, and it's been a little bit of a game, changing the wording and trying to, fly low, keep a low profile kind of thing. But my personal experience, I'm really struggling at this point. So yeah.
Thank you very much for sharing. Any more questions from the Q&A box, Layla?
Yeah, one question that's coming up is this idea of how could you disclose to an employer that you are not medically fluent in a language, as in practicing with it, but maybe you are conversationally fluent, or even a step aside from that, you have some language knowledge, but again, not fully fluent. Would that still be valuable to an employer in this field? And let's start with Dr. Salahuman for this one.
Okay, I saw that question. I started to type a response and then I noticed we're gonna probably take it to the group. I think it's really important for us to be open and honest with ourselves. I think, yes, so talking about the fact that you have conversational skills is not only important, but should be considered as an asset. Because if you're conversationally fluent, you could, and I'm assuming you're conversationally fluent enough to be able to, for example, have a conversation with a family and collect the information about case history, like background information that you need. But if your proficiency is limited to a point where you think, I cannot do a language assessment with a student, especially if the student's older, right? The words get more complex, more abstract. The grammatical structure gets more complex. So you really need to have much stronger proficiency if you're going to do a language assessment with a client who's anywhere past like mid-elementary grades. Then you also need to be honest and open about that, because your setting, your employer should know you're an asset and you can complete many things, including just connecting with families who speak the language that you have some proficiency in, but that they shouldn't rely on you to complete assessments, right? So they're clear about the fact that they may be working with you to identify resources for completing the assessment, even though you can do certain kinds of things with your conversational fluency.
Thank you so much, Marianne. I agree with everything that you brought up. I wanted to also bring up the honesty point is extremely important, because false fluency can be harmful as well. So we want to make sure that if you, I love the way Marianne put it, that if you have some, whatever level of proficiency, conversational, informal conversational, whatever level of language proficiency that you have, it goes a long way when you introduce yourself to the patient, or greet the patient in their language. And that alone, you're building that connection. Communication is at the core of what we do. And having that initial communication can build trust, can build rapport with the patient. So I couldn't agree with that more. And the honesty part, as considering that false fluency can be harmful. I'll give you an example. If you don't have enough fluency to repair communication when the patient did not understand the instructions, if you cannot convey that you want the patient to press the button every time they hear the tone, even when it's very soft, if the patient doesn't understand that, you are getting an audiogram with thresholds that are worse than the real hearing loss the patient has, and that might lead to an inaccurate diagnosis, inaccurate hearing aid fitting. So something that is very simple can lead to something that is not as simple. If you notice that the patient is not responding at threshold, but you don't have the communication level, the linguistic level to repair that and re-instruct and highlight that you're actually looking for threshold. You want them to press every time they hear the tone, even if it's tiny. Then that's a very simple example to convey that the accuracy, the proficiency in clinicians is extremely important to provide effective and safe clinical services. But by all means, everything counts, especially when it comes to building rapport and trust with patients. Thank you.
Alrighty, thank you very much. Thanks everyone for such great insights. For our last planned topic, there will be professional resources and communities linked. So for Dr. Saleh Hamoum and as well as everyone, what professional development and communities are you a part of or have found that support multilingual professionals?
I actually shared the page for the multicultural constituency groups that are part of ASHA, one of which is the Middle East and North African or MENA group. So I am a member of that. And I've always listed, so in my ASHA profile, I've always listed the Farsi as the second language that I speak. So people have found me through the ASHA website. So my affiliation with ASHA has been helpful over the years to the community of people who are looking for Farsi speaking SLPs. And then I also wanted to share, since we're talking about resources, again, I know I see the articles and some of the ASHA resources, but I'm going to share an article. I can't multitask. Let me drop that in. Okay. It's an article on Farsi English speaking bilingual children, but some of the recommendations are recommendations that would apply to assessing any bilingual child. And I'm also sharing it because this particular issue of perspectives was dedicated to assessment and intervention of bi and multilingual kids. So if you can find the issue, you'll find several different articles, each of which is dedicated or focused on one, like a different language. So it's a great issue. It's a great resource if you're interested in looking at not just guidelines, but resources that are listed within each of those articles. What else am I a part of? So ASHA, MENA, and other than the just collaboration with my own colleagues at Emerson who do the work through Bling, which is the bilingual and multilingual group who does extracurricular activities, and the interdisciplinary group. I can't think of any other groups that I'm a part of specifically for bi. Oh, I am on Facebook. Okay, so I wrote that name down for those of you who are interested. It's a great. I know that the organizer of it is a Spanish English bilingual person, Faye Murray. And the name of the Facebook group, I'll type it in after I say it, is Bilingual and Multilingual Speech Language Pathology. It's a Facebook group, and every week it posts lots of different resources or a question with a variety of resources related to that question. So I'll put it in. I'll put the name in that chat, in the chat as well.
Thank you very much. And anyone else, would they like to chime in as well?
I want to encourage all the CSD students and professionals to join ASHA API Caucus. It's also one of the multicultural constituency group, and the membership is free. And you'll get a monthly newsletter, including like employment opportunities, and they also have research symposium every year, and it's online, so very accessible. And during every year's ASHA, they will have a happy hour where you will meet all the members in person. And I went to the Boston one the year before, in 2024, I think, and there were a lot of people. And after the self-introduction, you will identify, like, you may meet someone with the same background as you. And if you are the only international student in your cohort, you may find another student with the exact same situation, and you can become best friends. And so yeah, that's the community I encourage the Asian students to join.
As far as resources, Carla, I'm sorry, I'm just gonna clarify what I shared. When in audiology, there's and also in speech and language pathology, so many resources as is in clinical tools such as quality of life measures and questionnaires and so on. So one thing that I always highlight to to students is that, when you use a translation, make sure it's been validated, make sure, it's not something that somebody translated. Ask what kind of population it was validated on. So I shared with you 3 of my favorite quality of life measures that I use for adults in a hearing loss clinic. And those have been validated, and you can see, I think, 2 out of the 3 have been validated kind of in a common Latin American Spanish to make it useful to multiple groups. Yeah, and the other thing is everybody should take some time to read the class standards from the Office of Minority Health. It gives you an idea of what is required from us as clinicians when serving multilingual and multicultural patients. Thank you.
Alrighty, thank you very much. Lila, what questions are people asking? Sorry, you're on mute. It's okay.
Oh my goodness. Okay. I'm so sorry about that. I am reviewing the chat right now. One thing that I am seeing are there any like specific community resources that you have been able to engage with to improve your experience as a clinician giving multilingual services, or at least experiencing with multiculturalism? And let's start with Emma on this one.
Yeah, I do have a resource. It's called Leaders Project, which is founded by a professor from our university, Teachers College, Columbia University. Her name is Dr. Cronley, and all the resources on that website is free, and including like the multilingual assessment materials and continued education courses, all free, and you can earn the hours to maintain your ASHA certificate. And so our school required us to do a course called Grammar Fundamentals. I did it just last week. It explains thoroughly about how language disorder is different from language differences, and so they also have multiple examples from like Spanish and African American English and Mandarin. I believe they also have French and German. So feel free to explore that website. I think it's quite famous because I knew this website even before I was enrolled in TC.
Any other questions from our audience, Andy?
Yes, so I have this one for Carissa. Someone had asked, I know this goes beyond just multilingualism, but how can we ensure that we have good cultural understanding of families and clients' routines and priorities to ensure that our practices are appropriate, respectful, and meaningful?
A great question. It's really going to vary by the patient and the language that they speak and their cultural background. I think that's the biggest thing to remember, is that it is not standardized. One deaf person may have a different background than another deaf person, and that's the same with any other language. And so you can do your research and read up on it, but you have to go into the appointment with the open mind that what you found may not actually align with their cultural values, and it may be something completely different. So if you have the time during the appointment, you can try and ask the patient, be like, hey, are you comfortable sharing with me a little bit about your cultural background? Is there anything I should be more aware of moving forward during our appointments? Is there anything that is overstepping a boundary for you. For example, for some patients, otoscopy, looking in their ears may be something that's a little uncomfortable for them, and asking them, how can we make that more comfortable for you moving forward? I think just the biggest thing is Google can help, but Google is not the answer. Your patient is the answer themselves.
Thank you very much. Now, all right, we're now going to have the opportunity to interact in small groups for the next 20 minutes. You'll be able to move between breakout rooms to learn more from each panelist. In the breakout room, panelists will introduce themselves in their known language or languages, share 2 to 3 beginner phrases when meeting or working with patients, anything that may be seen as a cultural faux pas, any helpful nonverbal communication cues, as well as any material or items that they may enjoy. Okay, let me just make sure we're all back. Okay, so thank you all so much for joining us tonight. Our panelists were awesome enough to offer their contact info if you want to connect with them individually. We'll drop that in the chat as well in just a second. We've also got a quick survey for you to tell us how tonight went. So the link will be posted below.
And we've got some more fall events coming up for students. We're super excited about our resume workshop and praxis kickoff, so definitely register to join us too. And then another quick reminder about all the awesome benefits that we have when you get to join NISLA, National NISLA. We have a 2026 membership that opened up earlier this month. As undergrads and grad students, members get access to cash awards, giveaways, scholarships, and you can apply for national level student leadership opportunities. Check out all the details on the NISLA website.
And then on behalf of National NISLA, a huge thanks to our panelists for sharing their time and expertise with us. If you want to connect with any of our panelists or me, feel free to screenshot this slide. This was such a great discussion, and we'd love your feedback. It's honestly because of these dedicated members like you that the CSD community keeps growing and thriving. This conversation was recorded and will be posted on National NISLA's social media. Thank everyone and have an amazing night.
Thank you. It was a pleasure to be here.
Thank you.
Thank you, everybody.